A very good morning to all of you all, my dear friends. Now we are going to prepare, we are in the process of preparing a proper pediatric dental education series, which will be of great help to not only to the student community, but also to the private practitioners and clinicians also, because all information related to pediatric dentistry will be divided in a series of lectures, and various aspects of pediatric dentistry will be covered. Now, the first topic which will be discussed in detail from today onwards is case history. Okay. So currently, I'm working in M.A. Rangunwala Dental College of Sciences and Research Center in Pune. I am Dr. Yusuf Chunawala, head of the Department of Pediatrics and Preventive Dentistry. Now, the topic which we are going to discuss in detail from today onwards for a few days is case history, diagnosis, and treatment planning, because the detailed case history is very essential as far as patient management is concerned, treatment plan is concerned, and various other aspects of pediatric dentistry. So now, by definition, what exactly you mean by a case history? So a case history is defined as a planned professional conversation between the patient and the dentist. Now, as far as pediatric dentistry is concerned, it can be the patient to a considerable extent, and also the parent also, or the caretaker, which enables the patient to express his symptoms, fears, and feelings to the clinician, so that the nature of the patient's real or suspected illness and mental attitude can be determined. Okay. Now, case history again. There is another definition given. It is a classic form of documentation. Okay, it involves a lot of documentation which ranges from clinical sketches to highly detailed and extended accounts that helps in arriving at a diagnosis and finally formulation of a treatment plan of the person under study. Okay, so it is a compilation of data, data which is of great relevance and will have a significant role in the management and treatment aspect. Now, another definition which we came across is that it is a first case history basically. It is a plan which, and the plan should include recommendation designed to correct the existing oral problems or halt their progression and to prevent anticipated future problems. And it is essential to obtain all relevant patient and family information to secure parental consent and to perform a complete examination of oral health care. Okay, so if you run through all these definitions, basically it tells that it is a compilation of data. We have one more definition for your reference. It can be considered as a planned professional conversation that enables the patient to communicate his signs, symptoms, feelings, and fears to the clinician, so that the nature of the patient's real and suspected illness and mental attitudes may be determined. So case history by itself, it gives you a complete information about the patient, and a variety of things are brought, or you can come to know about them in detail. Now, the collection of data concerning an individual, their family, and the environment, including the medical history, dental history, and any other information that may be useful in analyzing and diagnosing the condition, or for instructional or research purposes also, because all this, a great number of case histories, suppose you have 100, 200, 500 case histories documented with you, so you can, it can become a great source of information for research purposes also. Many conclusions can be derived from the data which you collect. Again, case history is a record of information relating to a person's medical condition, and it is used as an aid for diagnosis and treatment. And a case history usually contains test results, interviews, professional evaluation, and sociological, occupational, and educational data also. The level of patient's education, the level of parental education, That also gives us an idea about the awareness about the dental problems and various related issues. Now, what is the aim of case history in pediatric dentistry? Why do we need to take case history? Because it's a compilation of data and information. So now what exactly happens is that when you take a case history, it enables patients and his or her parents to communicate his or her symptoms to the clinician so that the clinician can obtain an insight to the nature of the patient's illnesses and his or her attitude towards the treatment. Yes, the attitude can be determined. Okay, sometimes you have a very well educated a child from a with very well educated parents coming to you, and he's got multiple carious lesions. The mouth is in totally tatters, and you wonder, I mean, they are so educated, they are affording category. What can be the reason of delay? Okay, there are situations like this. So how will you go about with it? So it might so happen that okay, both the parents genuinely don't have any time. Their job commitments are such that they are so busy that the child is always with the caretaker, and the caretaker may or may not furnish more details to the parents. So sometimes that also can be obtained. See, that's why when you record the occupation of the parents and you find both the parents working, so your question is who's taking care of their oral hygiene? Who's taking care of their food and dietary concerns, which have a direct relation to dental care? Then the second aim is to identify the possible signs of general conditions and disease. See, it is very well known fact that the oral cavity is the mirror of the full body. So sometimes just by plain oral examination, a lot of medical ailments are brought to the notice. Okay. A simple example, the patient has dryness of mouth, a typical bad odor coming from the mouth. He feels thirsty all the time. There is a possibility of diabetes. Okay. So these symptoms are purely oral. Okay. Then to provide the clinician, again, we're going through the aims to provide the clinician with the information concerning the patient's past dental, medical, and personal history. Past dental history is very important. Medical history, we don't have to explain, just very critical. Now, in past dental history, has he visited a dentist before? Is this his first dental visit? All that will help us plan. Okay, if he has a history of past dental history that he has visited dentist before, then you would like to know why did he visit, what was the main reason for the visit, okay, and what was the reason for him to change the dentist also. Okay, was he referred by the dentist because he's not a pediatric dentist and he knows that he cannot manage a child, hence he has been referred, or what else? Or maybe the clinic is located too far away and your clinic is very close by, so that can also be the reason for his visit to you, and to provide the clinician with the information that may be necessary for making a diagnosis. All signs and symptoms, history of pain, for example, night pain, okay, pain during sleeping, or pain at this particular juncture, pain. So various pain history which the patient gives can help you come to a diagnosis. To carry out all activities appropriate to the general dentist practice involving the prevention, diagnosis, and treatment of anomalies and disease of the teeth, mouth, jaws, and associated structures. Now, what is the prime objective? Okay, there is an aim, there would be an objective also. So, what is the objective behind taking a case history? First is to establish a positive professional relationship. Okay, there is, when you are noting down things, the patient and the parent especially feels okay, the doctor is making note of all these things, which is very critical. Okay, because they know that this data will help manage the child better. To formulate a pattern of asking relevant questions to get to the point data for the diagnosis, and as well as to alleviate the fear in the patients towards the disease and treatment. That is the main objective, because if you have lot of information about the patient, you know his likes, dislikes, and various other things, you will be able to manage him better. Okay, to gain an understanding of the patient's wishes and expectations. Okay, you should know what is the child expecting, what is the parent's expectation, so then you can work accordingly. Or if you feel that is not possible, your expectations are way beyond or difficult for me to execute for various reasons, so you can bring it to their notice. Okay, then for assessing the progression of disease and for future reference. So suppose you have treated 4 carious lesions and you have done the restoration, And then when the patient comes after a year or 2 years and you see them intact, and you see very few cavities or no new lesion, that indicates what? Okay, whatever instructions you gave have been followed very nicely. Okay, and suppose you have done a particular treatment, say for example you have kept a particular tooth, there was maybe a little bit of mobility in that tooth, and you have kept it under observation for some time, maybe for a month or two, so that it falls on its own. So then you get to know, okay, 2 months back there was this much mobility and now it is this. Or you have a case of traumatic injuries where there's been an injury and you have initiated a treatment. So in the follow-ups, okay, in 1 month follow-up, this is what I noticed. In 2 months follow-up, this is what I noticed. And in the fourth follow-up, this is what I noticed. So if you have the case history document with you, you can definitely understand the progression. And for gathering data for institutional review and research purpose. Okay, I mean, which area patient, see, like noting down a basic address of the patient, so from the address, okay, you then can come to the conclusion, okay, from this particular areas, a lot of patients are coming with this type of problem. Okay, for example, they're staying in a fluoride rich area. High water fluoride, content of fluoride in water is very high. So they have fluorosis. So you come to that, okay, from this particular area, these cases are seen. So this might be the possible cause. Okay, then establishing a provisional diagnosis on the basis of history and examination. Provisional diagnosis means it is a diagnosis based on whatever data and information which you collected before doing any tests. Okay, and of course for medical legal purposes also, because medical legal purpose is a very, very important aspect. So documentation will save a lot of time, energy also. Then understanding the need for referral to other departments and expectations of the outcome of referrals. Now, many a times the medical situation is there. The child has maybe a congenital heart disease. Okay, so you have clearly made a note that I will refer him to a cardiologist for fitness. For fitness is very important. So all that also will be documented in that. Okay, and to arrive finally to a tentative diagnosis. Okay, this is the diagnosis. See, from the what the history it gives, it seems like dental hypersensitivity. From the history which it gives, it seems like a simple enamel caries. Or from the history and like the clinical features, it seems that this particular tooth might require removal, root canal. So all that tentative diagnosis you can come. Okay, and then determine any systemic factors that may affect the formulation of diagnosis. Okay, is there any prevailing systemic condition, okay, that is causing any issue? So that also you can conclude. And finally, to determine any systemic conditions that require special precautions during the dental procedures to protect the health and life of the patients. Now, a simple example, the patient has got congenital heart disease. So in such a situation, can you start with any dental procedure immediately? No, it should never be done. In such a situation, what you will have to do? You will have to have a fitness certificate. So in that fitness certificate, what will you write? Respected so and so, I am referring this child for fitness for dental treatment under local anesthesia. I will be doing, for example, 4 extractions, that is tooth removal, 2 fillings, and maybe 2 root canals, which will be done in 3 to 4 appointments. And we will be using, local anesthetic, basically lignocaine hydrochloride with or without adrenaline. So kindly recommend what medication should be given prior, during, and after the procedure, and please recommend if any other special care is needed. So this, once the cardiologist or the concerned specialist goes through it, and then he will give us his recommendations, which will help us protect the health of the patient. Or if we start without any medications or pre-medication, if some complication happens and then you take the patient to the specialist, that's not fair. So this particular documentation will help to take care of that particular aspect also. And finally, to help in recording the intraoral and extraoral examination done based on the complaint of the patient. So there is an extraoral examination, there is an intraoral examination. So all this helps us to come to a conclusion and to record the specific intraoral lesions and extraoral lesions for record purpose, diagnosis, and effective treatment planning. So these are the basic objectives. And what is further, based on these findings and all, you decide to conduct the necessary investigations. And then, based on the reports that you receive from the investigation can be a simple radiograph, it can be any blood test, or any test which you feel necessary, which will help you to convert your provisional diagnosis into a final diagnosis. So, formulation of final diagnosis on the basis of the result of investigation is one of the major objectives. And then final is what? That making a treatment, proper treatment plan, and if required, any medical risk assessment for the dental patient. So these are the basic objectives of making a case history. So I would like to conclude my talk at this particular point. In my next lecture, as you can see in the slide, we are going to talk about what is the need of case history. Thank you so much for your precious time.